Hi, welcome back. So like I mentioned, we are now going to talk about our nursing experience, well, how we got into nursing. And I think it's important because I know a lot of you are maybe questioning about going into nursing. You kind of don't know what route to take. And we're going to share our experiences and hopefully it can motivate you or you have a little bit more knowledge about the field after watching this video. So I'm going to start off by talking about my experience. So after high school, I went to Fitchburg State. I went in as a bio major and I majored in bio and I did it for 2 years until I realized that I didn't like bio. So then I switched my majors my second year in to exercise and sports science. One of my advisors recommended it. So then I did that. And it required me to take summer classes and stuff, which I was fine with because I really liked the major. I learned so much about the anatomy and physiology, the body movements, body mechanics, kinesiology. I learned so much and I really liked it. But I knew that this wasn't like the end goal. I knew like I loved that aspect of it, but I wanted to work with a variety of different patients. So as I was in school, I was like looking at different graduate programs, what I wanted to go into. I went through so many phases. I once wanted to be a speech language pathologist, occupational therapist, physical therapist, so many different fields that I wanted to go into. But to be honest, it wasn't until I started working as an exercise physiologist that I really knew nursing was for me. So after I graduated, I got a job as an exercise physiologist and I loved it. I worked for, I think about 8 months until I went into nursing school. And I learned so much about cardiac and pulmonary. And it was just a great foundation for me to start my nursing program. But I loved it though. It was great. It was a great experience. So then once I got in, I did an accelerated nursing program. Well, we both did through Northeastern. It was a journey. It was 16 months of nursing. Like you had to take prerequisites before going into that program. And then that's what we did. And then once you're in that program, you just take strictly nursing classes. One more thing that I wanted to add in part of my undergraduate experience that I wanted to share with you. It's like, once you know that you want to go to graduate school, make sure your GPA is above a 3.0 because a lot of places won't even look at you if it's not. And I'm being as honest as possible. When I realized that I wanted to go into graduate school, I started retaking classes because once you graduate, that is it. That is your GPA. So if you're realizing like, shoot, like my first couple of years, like me, that I just kind of hung out, did a little partying and all of that, and then you really weren't as focused as you should have been, I would retake those classes and do better because your GPA will spike up. And you won't, like, I'm telling you right now, like if I didn't do that, I probably wouldn't have gotten into that accelerated nursing program. So moving forward, I did the accelerated nursing program for 16 months. It was really hard. It took so much time and sacrifice and dedication, but it was worth it. At the end of the day, like I got my nursing degree in and out. It was, that program specifically, it was costly, but if you can find a program that's cheaper, like state schools, I would do that. I would definitely do that because especially if you don't have that much of financial assistance, it can accumulate, it can add up. So I would definitely do that. But you have to sacrifice a lot of your time in nursing school. You have to dedicate. This is something that you want. So whether you might not be able to make it to parties, you might not make it to birthdays, you might not make it to a communion or whatever it may be. I remember my first semester, I missed Thanksgiving because I needed to study for that pathopharm exam and I wanted to get a certain grade just to put me at a level that I needed to be in. So it was a lot of work. After my 16 months, I studied continuously for my board exam, and I passed it with 75 questions within 2 months, and it was really good. And then now I'm working at an office-based addiction treatment center in Boston at BMC. Stop talking. It's your turn. Go.
So what's up, y'all? My name's Wale. I'm at A&M nursing school, but prior to that, let's rewind. So before going into college, my plan was to go to the NBA. I'm a hooper. Then after that,
He's joking, y'all.
So I'm originally from Boston, Mass. I went to Salem State University in Salem, Massachusetts, and I studied biology all 4 years. In those 4 years, I grew so much as a student, but I knew biology wasn't it for me. I wasn't into the classes. I wasn't into the biology classes, the chemistry classes. They just weren't for me. Even though I was passing them, some barely, it just wasn't for me. And I knew after those 4 years, I had to get a job somehow. And we all know that in order to get a job in biology, you have to go to grad school. And what's the point of going to grad school if you're only going to be getting so little money that you could barely pay off your loans? So I looked into my options. There was medical school, there was physical therapy school, there was nursing school. And I come from a long line of nurses from my mother, my 2 older sisters. And thank God from one of my older sisters, because she helped me with my applications. She helped me make the deadlines. She helped me study for my classes. And eventually I ended up at Northeastern. I did prerequisites like Ann did. And in 16 months, your whole life could change. You have personal issues, you have school issues, and you have internal issues that could bother you. But in those 16 months, you know there's a light at the end of the tunnel. You might have the greatest tragedy in your life. You might have people trying to stress you out, but you know deep down inside that you're doing this for you. And you're also doing this because you have $100,000 that you have to pay to the school. So stuff got to get done.
Yeah.
Stuff got to get done. There's no such thing as failing. There's no such thing as dropping out.
Yeah.
Because if you drop out, you still got to pay them.
Yeah.
And that's debt.
Yeah, and there's no safety net.
That's debt. So in those 16 months, we took vigorous nursing courses. We had various clinicals from pediatrics, maternity, and 2 med-surg clinicals, and also a psych clinical.
Yeah.
And you dedicate all your time to nursing school, like Ann said. All your time. There's no such thing as parties. If you go party and go to school, you're a legend.
Right?
So there's no such thing as parties. There's no such thing as going out.
Yeah.
It's just straight school. And Ann's Haitian, I'm Nigerian. And Nigerians only have one speed. Go.
There's no pause.
No pause.
And definitely no stop.
No stop. Everything's a green light.
Yeah.
When you're at school, then party. You can enjoy, you have your whole life to enjoy when you're done with school. And especially when you're making that nurse money, listen, you can enjoy it.
Exactly.
So right now I'm working on a med-surg unit. I was blessed with another opportunity that I'll keep you guys updated soon. And
yeah. But what we wanted to talk about too is your personal experience as being a Black male nurse. So how do you feel since working on the med-surg unit when you have patients or even coworkers? Do you feel like, you're noticed? Is there anything that you want to tell them that your personal experiences, just being a male and Black, it's like, whoa, minority and male. So there's only as statistics know, there's only 9.2% male nurses in the United States. And then if you're talking about minorities, there's only about 26.2% of minorities that are nurses. So you're over here in that low end of nursing. So how do you feel like that? How do you feel about that?
So first off, being a Black male nurse, I have two to three other Black male nurses on my floor, and
impressive. Good.
Yeah, and they're good mentors to me. They're both Nigerian men, and it's we click like that. It's more it's like a family thing. So with those two older black nurses, they point me out on stuff that I should fix. They point me out on things that I'm doing good and things that I could constructively work on. And I'm definitely noticed. I could definitely say that because we know nursing isn't full of people like us. And I feel like I'm able to not get into the banter, not to get into the drama that comes with it. And I just go to work, keep it pushing how it should be. And as a black male nurse, I just feel like I'm setting the tone for the other people who aren't in my department who could pursue this field, because there's people like me. I like sneakers. Who doesn't like sneakers? I like going out. I like getting fly. So why not? Like you can do all those things and keep being a profession that's prestigious.
Yeah, exactly. My next question was just going to be in regards to, do you feel like patients treat you differently? Like now, not your coworkers, but how about patients? Do you feel like, you know, there's a little stigma behind nursing? You know, everyone thinks it's not everyone, but a lot of people think that it's a woman's profession. And how has that affected you?
So there's been times where I had patients ask me, "Are you the doctor today? Who are you?" And I'll introduce myself as, "Good morning, I'm your nurse." And they'll be like, "How come you're not a doctor?" Not all doctors are males. There's plenty of female doctors. There's plenty of transgender doctors. There's plenty of doctors who don't want to identify themselves. So it doesn't just strictly being a male. You don't have to be limited to just doctors, PAs. There's so many avenues, so many different routes that you could take. And if you ask me, how come I'm not a doctor? How come you're not a doctor?
Right.
You feel me?
Yeah. And just to like add on to that, I think there is a lot of like misconception on what the nurse's role is. And I remember I was telling someone that, wow, like nursing school is so tough. We have to memorize all these medications. And then she looked at me and she was like, well, you're not in medical school. Why do you need to know these medications? And I'm like, well, I'm giving the medication to the patient. So of course I have to know it. I have to know what I'm giving to the patients. And I think that a lot of people forget that, like, you know, and I think doctors need nurses just as much as nurses need doctors. Doctors do a lot of the background work and we're just more with the patient. We're like assessing them. And the biggest part about nursing, and I really want to emphasize on this, is the fact that nurse's perspective and a doctor's perspective are two different perspectives. The doctors has like a disease-centered care model. We have like a patient-centered model, which we look at the patient and their lifestyle and how they live versus the treatment. And then we come together and we try to meet in the middle with them. Like, all right, so you like to do this. We have these options. Let's come together and come with a plan to better suit you. Because at the end of the day, it's the patient that we are concerned about and we need to work with them. So that's our model. And that's the difference for those who are wondering how we care for them and stuff and that nitty gritty stuff. But like I was piggybacking off of him saying, you know, people always question like, why are nurses? Why aren't you doctors and all that stuff? And there's nurse practitioners, which if you want to achieve that practitioner level where you can be a provider, you can obtain that by further education and getting your master's in nursing and obtaining a nurse practitioner degree. And that is always an option as well. If you are a nurse or if you're looking to be a nurse and you want to a higher level, like being a provider, you can be a nurse practitioner and you will be considered as a provider. And there's different parts of nurse practitioner, and hopefully we'll have a nurse practitioner here so you guys can pick her brain. But in the meantime, another thing we needed to add too was the money. So you can correct me if I am wrong, but when I was applying, this is just strictly on both of our experiences, I want to kind of say. Starting off as a nurse in the state of Massachusetts, when I was applying to different hospitals, I had a range of obtaining $30 an hour to $35 an hour as a new graduate nurse in Massachusetts. Now that is the base pay. When you work specifically in hospitals or sometimes in home care or wherever you work, there's something called differentials, right? And what time does differentials start?
3 p.m.
3. So at 3 p.m., starting with your base pay, you get added money. So it can be like $2, $3 added to your hourly pay. So for instance, if you work overnight and your base pay is $33, you get another $4 differential, which makes your base pay $37 an hour. And then you can do that times 40 hours a week, 52, you know, the salary rate. But yeah, so that is approximately the amount of money you can get in Massachusetts. And I know Massachusetts is like the second highest paying, pays the nurses the best. And I know California is like the first one and all that fun stuff.
And we're not even getting into overtime. There's so many routes, there's so many opportunities for overtime. So say like you're getting $35 an hour. Overtime's gonna be time and a half.
Yeah.
And plus, if they really need you, they'll give you a bonus on top of that.
Yeah.
So 35 times 40 times 1.5 is a PPP loan. You know what I mean? So that's, you're making ridiculous amounts of money, but you're working for it.
Yeah.
You're definitely gonna use the skills that you learn in school. You're definitely gonna use the skills that you learn in practice, and you're gonna hone those skills. I'm not gonna lie. When I first started being a nurse, my skills aren't what they are today.
Yeah.
So, and even 40 years from now, in my 40th year of practice, my skills will still be honed. There's no such thing as perfect in healthcare.
Yeah. And that's the thing too, it's a growing field. So you're continuously learning because medicine is continuously advancing. So you always have to leave room for growth in any type of medical field, because there's always going to be a new research article, a new medication that's out there that you're going to have to brush up on and make sure that you know this information so you know how to care for the patients that may potentially be on that medication as well. And what was the next thing? Different settings. I want to talk about different settings in healthcare. So you don't have to be limited in the hospital. You can work, in the school. You can work in home care, which is very flexible. You go into the patient's house and you assess them and then give them their medication, do what you have to do, go to the next patient and do the same thing. You're going into their homes to make sure that they're okay. And it's like following up after being in the hospital. So it's like the after care. There is, you can work in clinics, you can work, there's the different specialties in nursing, there's psych, there's trauma, there's ED, there's med surg, OBGYN. There's so many different specialties and you can work in so many different settings. Like you can work for the government as being a nurse and looking at malpractice issues. It's just so huge. Or you can, esthetician, like you can doing injections, like Botox injections, like if you're into that. Like there's just, you know what I mean? There's just so much to do in nursing. So it's definitely a field that if you are thinking about to consider, and I always recommend shadow. But always shadow someone, because you won't know until you visually see it and you're kind of in that setting. You're like, this is home. You're like, this is what I can do. I can see myself doing this. You won't know that until you're there. But we are coming to an end, right? But if you really like this YouTube video, please like and subscribe. Yeah.
Por favor.
Thank you for watching, and we're just so honored and blessed that you had time to take throughout your day to watch us, and have a wonderful, blessed day or evening or night or morning.
Whenever you're watching this.
Well, whenever you're watching this. Stay tuned for the next video. See ya.
Comments are on this time.
Yes.
We had a little technical issue the first time, but we figured it out.
And it's horizontal, y'all.
And it's horizontal.
And do you see the lighting?
Do you see the light?
Do you see the lighting?
I don't know. Can you see the light?
I think I do.
Type in the comments below if you see the light.
So, in other words, we listen to what you have to say and we take into consideration. So like I said,
Bye.